There we go. We'll record this for the folks who weren't able to make it. I even I even wrote myself a sticky note to remember to press it, and I always forget. So here we are. So this is a little bit of our agenda here. We'll talk about kind of Walk with the Doc, the program in general, how it got started, how it's grown over the last 20 years, what a typical Walk with the Doc event looks like, and then a little bit more about the impact and the benefits that we've seen both for the participants and the leaders. And then the bulk of what we'll be talking about is how to get a program started in your community. So our mission statement at Walk with the Doc is inspiring communities through movement and conversation. We do that through these free community walking programs that are, typically open to the community, to the public, and all of our events are led by licensed healthcare providers. A little bit about the origin story. That's Dr. David Sabger pictured there. He's a cardiologist here in Columbus, Ohio. Essentially, he'll tell you that he was frustrated that no matter how good of conversations he had with his patients about, how they need to exercise, get more physical activity. Yes, doc, I'll do it, I promise. They'd come back for their 6-month appointment, hadn't done anything that they said they would. So he'll say the program was born out of frustration. Really, he wanted to find that sticking point that got his patients to actually do the exercise that he had asked them to. So he wanted his patient to say no to his face when he asked, "Will you come walk with me?" And sure enough, they said yes. He had his first Walk with the Doc event in April of 2005, and people showed up. They were energized, ready to move, ready to connect with others, and that's kind of the origin of how the program started. We have since grown to almost 40 countries now, and almost 600 chapters of the program. So when I say a chapter, that's really a community that's hosting monthly, ongoing Walk with the Doc events in their community. 49 states. I'm sure someone is thinking, what's that one state? North Dakota. If you know any healthcare providers in North Dakota that are interested, send them our way. We'd love to make that 50. So walking through what a typical Walk with the Doc event looks like. As I mentioned, the walks are open to patients, community members, anybody that wants to attend. Each event is free. There's no cost for the participants, and each event is led by a licensed healthcare provider. We're open to working with physicians, physical therapists, allied health professionals. We've had nurses, dietitians, even medical students that have led Walk with a Future Doc events. So we're really open to anyone that's willing to share a little bit of their expertise and walk with the participants. So that's the who. The what the event looks like, it usually starts with a short discussion on a health topic from the healthcare provider of the day. Very brief, no PowerPoint slides, 5 to 7 minutes on a topic that they've chosen. We do send out a new topic idea each month with some talking points. Sometimes it's a little more, clinically based, like diabetes prevention, how to get better sleep. And sometimes it's a little more fun, like health benefits of gardening or, something along those lines. So we try to mix it up a little bit. So that's kind of the beginning of the event. We do have participants sign a waiver as well. And then the rest of the event, usually about 45 minutes, time to walk and answer questions and socialize and sneak in some exercise along the way. So whole event usually about an hour long. That's flexible, of course. People need to leave early or want to stay later. That's certainly fine. The when, we do ask that each chapter tries to host events at least once a month as much as possible. Your annual 5K and things like that are great for awareness building and some of those things, but we really do want our walks to be more of an ongoing walking club where people are getting to know each other and kind of getting in the habit of not only learning these health tips on a regular basis, but walking on a regular basis and building community around it. And then where, that's up to you. Most groups take place at a local park. Sometimes it works out well to have a short loop, like a paved trail, where people can maybe walk one lap within the 45 minutes, and that's about all they can handle. Others might, walk a little faster and do 2 or 3 laps within the hour. I did mention paved. We do want the walks to be open to people in wheelchairs, walkers, all of those folks as well. Some parks even have the option where maybe there's the short paved loop and then there's the longer, wooded trail that people can venture off on. It's pretty flexible, but having the walk leader be able to kind of bounce around to different groups as best they can is helpful. Some groups do meet indoors as well. Some groups will move into shopping malls, high schools, YMCA's, different locations like that for the winter. So that's always an option too. Our four components or our four pillars of Walk with a Doc. Dr. Sabger really started the program, as I mentioned, to try to motivate his patients to walk a little bit more and get more exercise. But we've really seen that it's much more than that. We talked a little bit about the health education. This is a captive audience where, you've got 5-7 minutes to share some health education. And really the emphasis on that is that this is a relaxed setting. It's very casual. Sometimes people can be intimidated to go into the doctor's office for the first time, with their white coat and their stethoscope. This really, helps build that patient-doctor relationship where they can, see that their doctor's in street clothes, ball cap and sneakers, just like them, and makes it much more approachable for that health education piece. Social connection, touched on that a little bit too. You've probably seen that the Surgeon General has announced that social isolation is an epidemic in our country coming out of the pandemic. So we really see the walks as a way to build community, help people socialize, get to know each other, find some common ground, and build some friendships along the way. Dr. Sabger will say that that's the glue that keeps his local chapter going over the years, is that social connection piece. And then finally, spending time in nature. I did mention that some groups will walk indoors. Most of them take place outdoors as much as possible because we do get that added benefit of being out in nature. A lot more research coming out on both the mental and physical benefits of getting outdoors. A little bit about the impact. We see benefits both for the participants and the healthcare providers that are leading the walks. So you'll see some stats on there. Essentially, walkers appreciate everything about those four pillars. Some people will show up because they really just need that accountability to keep walking. Others really are showing up just for that social piece. We have a local group here in Columbus, Ohio, where one of our participants, I think she's 98 now, and she shows up, loves to socialize, loves to kind of have the health education shared, and she might walk a little bit, she might not, but she's really there to socialize. So whatever reason people are coming to the walks, we're happy to have them there. And then for the walk leaders as well, we'll talk a little bit more about the walk leader benefit. Both for organizations that are hosting the walks and for walk leaders that are actually leading the walks. So for the organizations, this is a program that does foster that community engagement, which is good to do for the community. It's a good marketing opportunity for the organization. Just a good way to kind of build morale, build community between the organization and the community. And then for the walk leaders, we've heard all kinds of different reasons why our walk leaders lead the walks. They do volunteer to lead them, so they're getting something out of them. For a lot of them, they do say they do it for selfish reasons. It's good accountability for them to do the walks and get outside on Saturday mornings or whenever they choose to do them. We've heard a lot that it helps reduce burnout for the healthcare providers, especially with quicker and quicker office visits where you're in and out seeing patients all day long. The walks are a good way to kind of decompress, build those relationships, as I mentioned, get to know their patients a little bit better, and a few other things that you'll see on there as well. This wheel over here on the right, this is really, we say, why reinvent the wheel? Why try to start a walking program on your own? Walk with a Doc has this infrastructure in place that we've built over the last 20 years to really make it easy to get something off the ground. So a couple things on there. We are an evidence-based program. We worked with Robert Wood Johnson Foundation a couple years ago to do a feasibility study and really demonstrate that the program does have an impact both on the walkers and the leaders. Turnkey resources, we'll talk about that a little bit in a slide later on, but we've got lots of resources available to make it easy to get a program off the ground. Um, Media and brand recognition, Walk with the Doc, it rhymes. A lot of people have kind of heard of the Walk with the Doc concept or program. They find their way to our website, or they'll, see an article. We were recently in the Washington Post. We were in Good Morning America last year. So a lot of press coming out that trickles down to, participation at our local chapters. So that's helpful. Program support and flexibility. We've got all these resources in place, but there is some flexibility with the program. We're very flexible when it comes to making sure the program fits for you and for your community. Networking opportunities. You saw in one of those first slides, we've got about 600 chapters. We're always trying to make sure our chapters are connecting with each other, sharing ideas. We actually have our quarterly walk leader Zoom call next week, where we get together all of the walk leaders just to see, what's working, what's not working, sharing ideas amongst all the leaders. Turnkey resources. So again, just trying to make it easy to get the program started, ongoing support, really sharing best practices that we've learned from groups over the years. I'll show you some examples that are in our leader portal here in a minute. Liability insurance, we do have waivers for the participants to sign, but we actually take it a step further and have liability insurance for each chapter. Dr. Sabger's wife is a lawyer, so as soon as he had that great idea in 05 to head outside and walk with patients, she's like, great idea, but you need to have insurance for this sort of thing. So both US and Canada, we do provide liability insurance in case someone were to get hurt or fall or something like that at the walks. Marketing materials, we've got flyer templates, social media posts, other tools as well, just to make it really easy to spread the word locally. And then web page development, we'll build a website specifically for your walk chapter that has your walk schedule, your contact information, a new feature where walkers can actually RSVP for certain events. You'll have access to all of that information on the leader portal. So that's helpful. And then a merchandise package, we'll talk a little bit more about the options for that too. So here's just a glimpse of some of the things that are on the leader portal. I mentioned some of the flyer templates and social media posts. We do have example health topics as well for that 5-minute talk at the beginning. You'll see one on walking there pictured. Essentially, it's just a one-pager that's got some bullet points. We send out a new one each month, and our leaders are welcome to use that topic if they want, or they can come up with their own and share their own wisdom with the group. So that's flexible. We've got a quick training that leaders will go through before leading their first walk, just to kind of, orient them to the program and give them some tips for leading the walk. You'll find the waiver on the leader portal, and again, the opportunity to kind of manage your schedule and see participants that have RSVP'd, checked into walks, all of that. So what we're here for, how to get a chapter started in your community. I would say a lot of you have probably reviewed our guide to getting started already, but I would say take a look at that if you haven't already. The link is down there at the bottom, walkwithadoc.org/guide. That's going to be a little bit of review of what we've talked through on this webinar, but a few additional tips as well, particularly around building your team, choosing a location, setting your schedule. When I say building your team, that's very flexible. We've got some groups that are led solely by a doctor or a healthcare provider that's really, promoting the program to their patients and kind of running the program on their own. And then all the way on the flip side of that, we've got some communities that partner with lots of different organizations, whether it's local hospitals, medical society, Parks and Rec department, YMCAs, senior centers, and local businesses to really make it kind of a coordinated effort amongst the city. So very flexible. We've seen everything in between. And I think that's a good thing about the program is it can really be led by one or many. As far as actually, hopefully you see the benefits, you're excited to get started. Once you're sold and want to start a chapter in your community, we have some housekeeping items to complete. You should have gotten a link to that at some point. I think there's a link to it in the guide as well, but if you need that, just email me afterwards and I'll make sure to get you a link. there's some paperwork to complete. So the marketing and licensing agreement might need to go to your organization's administrators or legal team or something like that. Happy to make any changes that they need for the agreement. The online application, that's going to be more details about your walk schedule, your kickoff date, all those details. We'll use that to purchase the liability insurance, get your website built, and kind of get you started for the first event. And then membership options, we'll talk more about those, but a couple different package options depending on how many t-shirts, pedometers, yard signs, all of that you might want. We do recommend trying to get signed up about 4 to 6 weeks before your first walk. We're pretty quick, so we'll get the merchandise to you within probably a week. Everything else will be set up sooner than that. So some groups like to, get started right away and let the program slowly build over time. Other people like to spend a few months to really spread the word and try to have a big kickoff. So we're flexible there. Here's our current merchandise packages. Note at the bottom in red, don't be scared away by dollar signs. We're a nonprofit. We've got scholarship options if cost is an issue. So let us know. But essentially, it costs us about $700 to start a new Walk with a Doc chapter. That includes, membership, marketing materials, the liability insurance, and then the merchandise that you'll see listed here. So we've got Walk with a Doc t-shirts, signage. The prescription pads are actually a prescription pad for the doctors to prescribe the upcoming walks to patients. Sometimes that's a good way to make the patients feel a little accountable to actually come to the walk when you've got a prescription in your hand that says you need to. So a couple merchandise packages. I will note too at the bottom there, if you are in Texas, we partner with the Texas Medical Association, and so it's free to start a chapter in Texas if you're working with a TMA member. So just wanted to mention that. And then another note at the bottom, renewal fees are currently $250 per year. Same thing, that's our insurance cost, but we've got scholarship options and ways to help out if that's an issue. And then an add-on option, especially when we're working with larger organizations or a couple organizations, they like to add their logo to the t-shirts and the banners and all of that merchandise. So we do have what we call our Premier Partner option. It's an additional $2,500 per year sponsorship and allows you to co-brand any of the materials and some additional sponsor recognition. We'll put you on our sponsor page on our website. We'll do a Facebook ad for your first walk, recognize you on social media and our newsletter too. This is a quick video, and I think this is should be my last slide. I've talked at you a lot, so I'd love for you to just hear from some of our walk leaders around the world about their experience with the program.
Hello, thank you for having interest in Walk with a Doc. Honestly, the days I spend at the walk are my favorite part of the week. I can't ever remember leaving a Walk with a Doc event and not feeling great. It is 100% changed the way I practice medicine over the last 16 years. But don't just take it from me. Please hear from our leaders around the world.
I didn't want to be the kind of doctor who just prescribes pills and insulin. I wanted to help people live healthier lives by making lifestyle choices.
I think medicine is more than just a profession. It's, a calling, and it's an oath to uphold the things that we're supposed to be doing. And reaching out to your community is what you're supposed to be doing.
My passion as a pediatrician is to help families get healthier. I was becoming frustrated that in the office, no one seemed to be listening to me, and I wanted to do something that was free and open to the community.
One of the things that's important to us is encouraging people to get activity and exercise.
There was a need for my patients to exercise in a setting that didn't necessarily require a lot of equipment or a significant amount of effort.
Instantly, I knew that this could be something we could bring to Boulder, and it could be pretty easy to put in place, mainly because of what Walk with the Doc has created, their toolkits and everything else.
Don't be afraid to do it. I mean, it's fun. Once you start doing it, you won't want to stop.
You are definitely changing lives by starting this initiative and just putting your best foot forward, literally.
I wish every town, every city, every community has a walk.
Program is phenomenal. It is innovative. It's really kind of grown from the heart.
You're gonna help so many people.
What Dr. Sapir started, I think has made an impact throughout the world. And we're just really super grateful to be part of that.
Hello.
Oh boy. How do I get to my next slide? There we go. Thank you. Thanks for being here. I did see a couple questions in the chat, but for those that need to go, contact information's at the bottom there. My name's Brian. Send us an email or give us a call. Poke around on the website. Would love to, keep the conversation going. And if you're ready to get a chapter started, or maybe even check and see if there's already one in your community that you can partner up with, we would love to have you involved. I'm going to start. I did see a couple questions in the chat here, so I'm going to address a few of those first, and then we'll open up mics to anybody else that has questions. So Ken asked about ideas to identify an indoor location for bad weather. That's a good question. Sometimes groups will move, or they'll partner with like a YMCA that has an indoor track. Others have moved into high school gyms. We've seen even some do like grocery stores or even like a Home Depot big box store. So those are a couple options that come to mind. Some people will walk outside and just bundle up for the winter, and others will, just take a break and regroup in the spring. Or I guess I should say for those that are really hot in Texas or some of those southern states, they'll regroup in the fall. Shala asked about having weekly walks. So yes, frequency is up to you. Again, our loose commitment is monthly walks as much as possible. If you need to take a break here and there, that's no problem. Weekly is great. Dr. Sapir's group meets every week. You don't necessarily need to do a health topic every week. Some of our groups will do like a weekly walking club where the group's getting together every week. But then once a month, they'll do a formal walk with the doc where the doctor's actually giving the short presentation. So good question. Someone asked, do walks need to be at the same location or can they bounce around? Our preference is to have the walks at a consistent location. It not only makes your life a lot easier when you can promote, we're walking on the first Saturday of every month at 9 o'clock at this park, rather than trying to schedule and promote events individually. It's a little bit more work, but especially in some of our rural communities, they need to make sure that they're touching different parts of the county. So if you need to try out some different locations, that's fine, and we can make that work with our liability insurance. Carr asked about a social media chat feed to support organizers. We do have a leader Facebook group where our leaders are kind of sharing ideas and chatting with each other. I mentioned the Zoom calls that we do for our leaders as well. Can those who are not licensed healthcare providers help to organize? Absolutely. We've got community members that volunteer to help promote and help with the sign-in sheet, or maybe even bring some snacks and drinks to the walk. So we love getting our community members involved. Other groups will partner with, like an AARP or some sort of community organization to help with some of the logistics and promotion for the program. Sheila asked about including children. Absolutely. Walks are open to all ages, all abilities. We've had some pediatricians that have even done some fun bonuses for the kids, bringing some sidewalk chalk to play tic-tac-toe, bringing jump ropes, some like healthy snack stations for the kids. So whatever you can do to get the little ones to come is great. Some groups have partnered with like local schools, churches, various community organizations that can help reach children as well. And then I see a lot of comments about where people are from. That's exciting. Looks like we're from all around the country. I will send the recording. I will send these slides. It is not required that surfaces are paved. Again, it's helpful to make it inclusive for those in wheelchairs and walkers. But if that's not an option, then that is certainly fine. Someone asked about Walk with a Future Doc. So that is partnering with either formally partnering with a medical school or informally partnering with medical students. Essentially, the program looks exactly the same, just the students are the ones helping to lead the events and promote the program. Same paperwork, all of that. Just we have a Walk with a Future Doc logo that will go on the t-shirts and the flyers and all of that. How do I find a doc? Good question. Sometimes can take a little bit of work. Obviously, hard to have Walk with a Doc without the doc or the healthcare provider. So we've seen groups that have, just contacted a local clinic, a local hospital, family medicine and lifestyle medicine and sports medicine physicians are often the ones that are inclined to start something like this. But we've worked with any specialty of doctor or provider. I think I mentioned physical therapists earlier. So various healthcare providers that can be leading. Some groups have reached out to their public health department or like a city or county medical society to help find healthcare providers. It can take some work. That's usually the hardest piece when you're a community organization that's trying to start a program. So good luck. If we can help in any way, let us know. Amy asked about asking for permission from the local government or whoever hosts the park that you're walking at. I get that question a lot. It's always the old asking for forgiveness versus permission thing. We have some groups that they show up, they do the walk. It's fine. They can just show up, and especially with these, this isn't, again, not your marathon or your 5K where you're closing off streets and getting police escorts and all that. This is a casual walking club. Usually the parks have no problem with people showing up to do the walks. But some groups do like to reach out to the park system. They might have some paperwork for you to fill out to, reserve the pavilion or wherever you're going to do your walks. And the good thing about that is they might be really excited about it, excited to have people in the park, and they might help promote the program, maybe point you to some resources. So it definitely doesn't hurt to reach out to the park department. Have any programs billed for this, like a group session? At the moment, Walk with a Doc is not a billable program. We've looked into it in the past, but not currently an option. How do I find if there's a chapter in my community? Go to walkwithadoc.org. You'll see a button to join a walk. You can put your zip code in, and there should be some pins to chapters that are nearby. Concerns about liability. That's a big reason why we exist. The participants will sign the waiver, but we do also take out the liability insurance for the chapter as well. Let's see. Can you move a chapter to a different city after you've started? That's a good question. We've had a handful of providers that have done that. They've moved to a different city or retired and went south. So we can definitely transfer a city to a new location. Someone asked about free materials. Unfortunately, we do pass along our cost. The flyer templates are free. You can download those and get those printed out. But try to keep the program sustainable. Don't promise everyone a free t-shirt if there's not funding available for t-shirts. We do really want it to be a ongoing sustainable program with very minimal costs. So keep that in mind as you're dreaming big about what your program might look like in the future. Okay, hopefully I got most of the questions in the chat. Feel free to turn on your mics or keep dropping questions in the chat if there's any more questions. Here's one more. Marketing materials in Spanish. We do have materials available in Spanish. For some reason, Walk with a Doc is really big in Hungary and Portugal. So we have materials available in those languages as well as a few others.
Brian, this is Alan Tabbs calling from Miami.
Hi, Alan.
How are you doing? So about a month ago or a month and a half ago, I got an email from I think it was either the University of Miami or FIU down here that they were planning on starting a walk with a doc. Did anything ever come of that?
They haven't signed up yet, but I do know they're still working on it.
Okay, so I guess notification will come out in case they do get involved.
Yeah, I'll make myself a note to send you an email directly too.
Okay, thank you.
You're very welcome. Sheila asked about people buying t-shirts. Yes, walkwithadoc.org/shop. We have t-shirts, hoodies, hats, all kinds of good things on there. Any other questions, concerns, anything like that? It looks like Darlene is out walking right now. She's showing us all up. So good for you, Darlene. I'm going to head out for one as soon as we're done here. You've inspired me. Great. Well, if there's not any other questions, I will send out this recording to everyone that registered. I'll send out the slides as well. I'll include a link to the housekeeping items to complete, when you're ready to get started. And if any other questions come up, just shoot me an email. We are happy to chat. Thanks, everybody. Take care.
Thank you, Brian.